Seattle Presbyterian Hospital's Level 1 Trauma Center was a cathedral of modern medicine, a place of gleaming chrome, blinding white lights, and egos large enough to command their own gravitational pull. In the center of this pristine, sterile universe stood Daniel Vance. At 45, Daniel looked entirely out of place among the fresh-faced, hyper-competitive nursing staff. He was a quiet, broad-shouldered man with a dusting of premature gray at his temples and a calm, almost maddeningly steady gaze. His standard-issue blue scrubs always seemed a little too loose, deliberately masking a heavy, scarred physique built not in a luxury gym, but through decades of carrying heavy burdens across unforgiving, hostile terrain. But here, in Trauma Bay 1, Daniel wasn't a hero. He was just the new hire, a glorified orderly in the eyes of the elite medical team. Enter Dr. Eris Thorne. Thorne was 32, Ivy League educated, and currently the youngest chief trauma surgeon in the hospital's storied history. He walked into the trauma bay with the swagger of a reigning monarch, his entourage of exhausted medical students and junior residents trailing closely behind him like ducklings. Thorne's scrubs were perfectly tailored, his hair flawlessly styled, despite being 8 hours into a grueling 12-hour shift. He thrived on the adrenaline of the ER, but more than anything, he thrived on absolute, unquestioned authority. "Nurse Vance," Thorne snapped, his sharp voice cutting easily through the rhythmic hum of the cardiac monitors. He didn't even bother to look up from the digital chart in his hands. "Did you prep the central line kit for bed 3 like I asked 10 minutes ago, or are you still trying to figure out which end of the needle goes into the patient?" A chorus of stifled giggles rippled through the young medical students. A younger nurse, Sarah, cast a sympathetic look toward Daniel from across the room, but she kept her mouth shut. No one dared cross Dr. Thorne. Daniel finished wiping down the stainless steel Mayo stand, his movements deliberate, methodical, and unhurried. He turned to face the surgeon, his voice low, slightly raspy, and devoid of any defensiveness. "The kit is prepped, doctor. Standard setup plus the extra wide-bore access you usually prefer for incoming crush injuries." Thorne finally looked up, his eyes narrowing in irritation. He walked over to the tray Daniel had carefully prepared, inspecting it as if he expected to find a live grenade resting among the gauze. With a theatrical, heavy sigh, Thorne used the tip of his expensive pen to push a sterile-wrapped syringe exactly half an inch to the left. "I asked for a standard prep, Vance, not your creative interpretation of one," Thorne said loudly, ensuring the entire room was listening. "Look at this layout. It's sloppy. It's disorganized. I don't know how things were run at whatever sleepy, small-town urgent care clinic you crawled out of, but here at Presby we deal in precision. Lives depend on my speed, which means they depend on your competence. A terrifying thought, honestly." Daniel's jaw tightened for a fraction of a second, a fleeting micro-expression that went entirely unnoticed by the arrogant surgeon. Beneath the loose sleeves of his scrubs, his right hand instinctively curled into a fist. His knuckles bore the faint, silvery webs of old blast scars. He could have told Dr. Thorne that his tray layout was specifically optimized for zero-light conditions, a muscle memory habit formed while patching up shattered limbs in the back of a Black Hawk helicopter taking heavy anti-aircraft fire over the Corangal Valley. He could have mentioned that he had forgotten more about saving human lives in the last 10 years than Thorne had ever read in his pristine textbooks. Instead, Daniel slowly released his grip. He inhaled the sterile, bleach-scented air of the civilian hospital. "Peace," he reminded himself. "No gunfire, no screaming. Just take the hit, follow orders, and clock out." "My apologies, Dr. Thorne," Daniel said quietly, bowing his head slightly in a deliberate gesture of engineered submission. "I will adjust it to your exact specifications." "See that you do," Thorne sneered, turning his back on Daniel to address his sycophantic audience of interns. "It's like trying to teach an old dog to do open-heart surgery. Honestly, administration needs to stop treating this department like a retirement home for washed-up medics. The man moves like he's walking underwater." The words stung, not because they were true, but because Daniel had to let them hang in the air, unchallenged. The whispers of his colleagues burned into his back as he silently rearranged the sterile instruments. He was the punching bag, the slow, quiet rookie who didn't know how to fight back, and that was exactly how he wanted it. Anonymity was his armor. But the quiet never lasts. Suddenly, the harsh electronic blare of the hospital's red emergency line, the direct bat phone connection to regional crisis dispatch, shattered the tense silence of the room. It wasn't the standard EMS ringtone. This was the rapid, high-pitched klaxon reserved only for catastrophic events, mass casualties, citywide disaster alerts. The charge nurse sprinted to the desk and grabbed the receiver, her face drained of all color in an instant. "What? Say that again? How many?" She looked up, her eyes wide with sudden, unadulterated terror, meeting Dr. Thorne's gaze across the room. "Doctor," she stammered, her voice trembling so hard she could barely form the words. "There's been a massive ambush on the downtown expressway. A highly classified federal convoy was hit by explosives. Heavy casualties. They're bypassing the military hospital. They're bringing them here. ETA is 2 minutes." Before Dr. Thorne could even open his mouth to issue an order, the distinct, window-shattering, rhythmic thunder of heavy military helicopter roppers began to shake the reinforced glass of the trauma bay. The true storm had arrived.
The deafening thwack, thwack, thwack of twin-engine military Blackhawks rattled the loose ceiling tiles of Seattle Presbyterian's trauma center. The double automatic doors of the ambulance bay didn't just slide open, they were violently shoved apart by heavily armed men in soot-stained tactical gear. "Clear the bay! Clear the damn bay!" roared a man in a shredded plate carrier, his rifle slung tight across his chest, his eyes wild with adrenaline and fear. The civilian medical staff froze, paralyzed by the sudden invasion. Dr. Eris Thorne, usually the unquestioned master of his domain, stood momentarily rooted to the floor. The pristine, highly organized world he commanded was instantly shattered by the acrid smell of vaporized copper, burnt Kevlar, and the heavy, metallic scent of fresh blood. 3 stretchers were violently wheeled into Trauma Bays 1, 2, and 3. These weren't the typical Saturday night car crash victims or bar fight casualties Thorne was used to. They were federal tactical operators, their uniforms blackened by explosives, their heavy tactical vests hastily cut open to reveal catastrophic blast injuries. From the corner of the room, Daniel Vance felt a familiar, icy calm wash over his nervous system. The massive spike of chaos that made the civilian doctors tremble was the exact chemical cocktail his brain had been trained to operate on for 2 decades. He didn't panic. He just stepped back against the wall, out of the way of the Russian crowd, his eyes scanning the chaotic influx with the cold, mechanical precision of a targeting laser. "All right, listen up." Dr. Thorne finally found his voice, clapping his hands loudly to break the spell over his terrified staff. His massive ego quickly overrode his initial shock. "This is my ER. I want full trauma panels, cross-match for 6 units, and get respiratory down here now. Vance, stop staring at the wall like an idiot and bag that discarded gear." Daniel nodded silently, moving slowly to gather the bloodied tactical equipment, but his eyes never left the patient in bed 1, a massive, heavily muscled operator who was gasping for air like a fish thrown onto dry land. Thorne rushed to bed 1, snapping on sterile gloves with a theatrical snap. "What do we have?" "Male, unknown age, caught in the primary IED blast radius. He took shrapnel under the arm. We applied a standard compression bandage, but he's crashing. You have to save him, Doc. He's the team lead." "I don't care if he's the president. Step back and let me work," ordered Thorne, his voice dripping with his usual condescension. "Nurse Sarah, get 2 large-bore IVs. Start pumping normal saline wide open. His pressure is dropping. We need to counter the hypovolemic shock immediately." From his spot by the discarded gear, Daniel's brow furrowed. Normal saline for a massive trauma bleed? The synthetic fluids would just wash out the patient's remaining clotting factors, drop his core temperature, and accelerate the bleeding. The man needed whole blood and a massive transfusion protocol, not salt water. But Daniel held his tongue. He was just the rookie nurse. "Pressure is dropping fast, Dr. Thorne. 70/40, called out Sarah, her hands shaking violently as she tried to find a viable vein in the operator's collapsing vascular system. "Push harder on the fluids," demanded Thorne, grabbing a stethoscope and slamming it against the man's chest. The patient's lips were turning a terrifying shade of blue. His chest heaved violently, but only one side was rising.
The cardiac monitor began to scream a high-pitched, erratic warning. "He's in ventricular tachycardia," a panicked intern shouted. Thorne's perfectly styled hair fell into his eyes. A bead of sweat formed on his forehead. "His heart is failing from the blood loss. Charge the paddles to 200 joules. We need to shock him back into a normal rhythm before we lose him." Daniel stopped organizing the gear. He dropped a blood-soaked ceramic armor plate onto the floor with a heavy thud. Thorne was misreading the entire situation. It wasn't just hypovolemic shock. The shrapnel under the arm had punctured the lung. The concussive blast wave had forced air into the pleural cavity with nowhere to escape. It was a textbook catastrophic tension pneumothorax. The trapped air was physically crushing the man's heart and lungs, physically stopping the heart from beating. Shocking him with a defibrillator wouldn't just be useless, it would waste the final 15 seconds of the operator's life. "Clear!" yelled Thorne, holding the paddles over the dying man's chest. "Doctor, wait," Daniel said, his low voice slicing cleanly through the frantic screaming of the monitors. Thorne didn't even turn around. "Shut up, Vance! Clear!" Thump! The man's body arched off the table. The monitor continued its deadly, erratic screech. The jagged lines were flattening. "Charge to 300, Thorne ordered, genuine panic finally cracking his arrogant facade. "Come on, damn it, push a milligram of epinephrine." The patient's oxygen saturation plummeted to 50%. He had seconds left. The other operators in the room began to yell, sensing the slipping grip on their commander's life. Thorne raised the paddles again, completely blind to the true mechanical cause of the man's dying heart. Daniel closed his eyes for a fraction of a second. He had promised himself he was done with this life. He had promised he would just be a quiet, invisible civilian clinic nurse. Screw it, Daniel thought. Daniel stepped away from the wall, his demeanor entirely transformed. The hunched, submissive posture of the washed-up rookie vanished in an instant, replaced by the lethal, coiled energy of a Tier 1 Master Chief. He walked directly towards Trauma Bed 1. "Dr. Thorne," Daniel said, his voice no longer a polite request, but a hard, unyielding command. "Put the paddles down." Dr. Eris Thorne froze, the charged defibrillator paddles suspended over the dying man's chest. The only sound in the trauma bay was the frantic, high-pitched alarm of the cardiac monitor. Thorne turned slowly, his eyes wide with a mixture of disbelief and incandescent rage. "Excuse me?" Thorne hissed, the perfectly cultivated arrogance returning to his voice. "Did you just give me an order, Vance? Step back against that wall right now or you are fired. I will personally see to it that you never work in medicine again." Daniel didn't blink. The stoic, submissive posture he had maintained for months vanished, replaced by a terrifying, immovable presence. He closed the distance between himself and the surgical table in 2 long, predatory strides. His movements were no longer sluggish. They were a blur of lethal, calculated efficiency. Before Thorne could react, Daniel's large, scarred hands clamped over the surgeon's wrists with the strength of a steel vise. He didn't hurt Thorne, but he effortlessly forced the doctor's arms down, pointing the deadly charged paddles away from the patient. "Cancel the charge," Daniel commanded, his voice a low, gravelly bark that echoed with absolute battlefield authority. "He doesn't need electricity, doctor. He needs a release valve. His heart isn't failing, it's being crushed." Thorne sputtered, trying to yank his hands away, but Daniel's grip was unbreakable. "Get off me! Security! I need security in Trauma Bay 1. Daniel released the doctor with a dismissive shove, stepping seamlessly into the primary caregiver position. The panicked tactical operators in the room, who had been shouting seconds before, suddenly fell dead silent. They recognized that posture. It was the undeniable aura of a senior operator taking command of a chaotic hot zone. "Cancel the epinephrine," Daniel ordered, not looking at Thorne, his eyes locked on the patient's rapidly bluing face. "Stop pushing normal saline. You're washing out his remaining clotting factors and pushing him into hypothermic coagulopathy. Call the blood bank. I want the massive transfusion protocol initiated. Get me 4 units of O-negative, uncross-matched, on a rapid infuser. Now!" Nurse Sarah stood frozen, her eyes darting between the furious chief surgeon and the quiet rookie who had suddenly morphed into a commanding officer. "Sarah, move!" Daniel barked, the sheer force of his command snapping her out of her paralysis. She sprinted for the blood cooler.
"You are a glorified orderly," Thorne screamed, his face flushed purple as he tried to push his way back to the table. "You cannot make that call. He is in VTAC." "Look at his neck, doctor," Daniel said coldly, his hands moving over the patient's chest with blinding speed. "Distended jugular veins, tracheal deviation to the left. He has 0 breath sounds on the right side. The blast wave and the shrapnel created a one-way valve. It's a massive tension pneumothorax. The trapped air is compressing his vena cava. Shocking him would have flatlined him permanently." Thorne opened his mouth, but the medical terminology hit him like a physical blow. He looked at the patient's neck. Vance was exactly right. "I need a 14-gauge needle," Daniel said, holding his hand out. When the stunned intern beside him didn't move, Daniel shoved past him, ripping open a sterile supply drawer and grabbing the needle catheter himself. He didn't hesitate. He didn't ask for permission. Finding the second intercostal space at the mid-clavicular line on the right side of the patient's chest, Daniel drove the heavy needle straight into the pleural cavity. A loud, distinct hiss of pressurized air violently escaped the catheter. Instantly, the dying man's chest deflated to a normal size. On the overhead monitor, the erratic, terrifying screech of the VTAC vanished. The jagged lines dropped, smoothing out into a rapid, beautiful, and stable sinus tachycardia. The patient's oxygen saturation began to climb. Daniel had just pulled the man back from the absolute brink of death in under 10 seconds. But Daniel wasn't finished. "Hand me a vented chest seal," Daniel ordered, the intern who finally scrambled to obey. Daniel slapped the adhesive dressing over the shrapnel wound to prevent air from re-entering. Then he ran his blood-slicked hands down the patient's legs, his tactical triage instincts taking over. "We have a secondary arterial bleed, right femoral." Reaching into his own scrub pocket, Daniel produced a black combat-issue cat tourniquet. He slipped it high and tight around the operator's thigh, cranking the windlass with brutal, practiced force until the bright red arterial spurts completely stopped. The lead tactical operator standing by the door stared at Daniel, his jaw slacked. Who the hell are you, man?" Before Daniel could answer, the double doors to the trauma bay violently burst open. 3 heavy-set hospital security guards rushed in. "There he is," Thorne screamed, a trembling, furious finger pointing at Daniel. The surgeon's ego had been publicly shattered, and his rage was boiling over into absolute madness. He just assaulted an attending physician and performed an unauthorized, invasive surgical procedure. "Get this lunatic away from my patient and get him out of my hospital." Daniel slowly turned away from the stabilized table, his eyes locking onto the approaching guards, his stance shifting into something deeply dangerous. The 3 hospital security guards rushed into Trauma Bay 1, their hands resting cautiously on their utility belts. They expected to find a violent psychiatric patient or a combative drunk. Instead, they found Daniel Vance, the quiet, middle-aged clinic nurse, standing with absolute terrifying stillness over a critically injured federal operator. "Get him away from the table," Dr. Thorne shrieked, his voice cracking with a mixture of public humiliation and unhinged rage. He pointed a trembling finger at Daniel. "He just assaulted me. He performed an unauthorized, invasive needle thoracostomy. He's practicing medicine without a license. Grab him." The lead guard stepped forward, reaching out to grab Daniel's shoulder. "All right, buddy, let's step away from the—" "Touch him, and I will break your arm in 3 places," a low, dangerous voice growled. It wasn't Daniel who spoke. It was the lead tactical operator, a soot-covered giant of a man named Miller. Miller stepped directly between the security guards and Daniel, his hand resting firmly on the grip of his holstered sidearm. The other 2 uninjured operators mirrored his movement, instantly forming a heavily armed wall between the medical staff and the surgical table. "Are you out of your minds?" Thorne screamed, his perfectly styled hair now matted with sweat. "This is a civilian hospital. You are in my trauma center. That man is a glorified orderly. He was killing your commander." "The only person killing my boss was you, Doc," Miller fired back, his eyes narrowing into a lethal glare. "You were about to shock a man with a collapsed lung. I may not have a fancy medical degree, but I've seen enough combat trauma to know what a tension pneumo looks like. The quiet guy saved his life. The quiet guy stays. I will have this entire hospital locked down. I'll call the police," Thorne spat, his face turning an unhealthy shade of purple.
He turned to the charge nurse who was staring at the scene in absolute shock. "Call the police. Tell them we have an armed hostage situation in Trauma 1. And Vance, you are finished. You will spend the rest of your life in federal prison." Daniel ignored the screaming. He ignored the guards. He ignored the guns. His entire universe was narrowed down to the rhythmic digital pulse of the cardiac monitor and the pale face of the dying man on the table. "Sarah," Daniel said, his voice cutting through the chaotic screaming with eerie glacial calm. "He's still hypotensive. Squeeze that blood bag. He needs volume pushed faster." Nurse Sarah hesitated for a fraction of a second, looking at the furious chief surgeon. Then she looked at the monitor. The patient's heart rate was stable only because of Daniel's intervention. She made her choice. She grabbed the blood bag and squeezed it hard, actively defying Thorne's orders. "Sarah, you are fired," Thorne bellowed. Suddenly, the monitor began to scream a new, frantic alarm. The steady rhythm Daniel had fought so hard to establish began to fragment. The patient's blood pressure, which had briefly climbed, was plummeting again. "Pressure's tanking, 60/30, the intern yelled, his voice cracking with panic. Thorne pushed his way past the operators, desperate to reclaim his authority. "See? He punctured the subclavian artery with his reckless needle thrust. I told you he was killing him. Step aside, Daniel. I have to open his chest." Thorne reached blindly for a scalpel, his hands shaking so violently he nearly dropped the stainless steel instrument. He had completely lost his nerve. The adrenaline had burned off, leaving behind nothing but the raw, terrifying reality that he had no idea how to save this man. Daniel's large, scarred hand shot out, clamping gently but firmly over Thorne's trembling wrist. He stopped the scalpel inches from the patient's skin. "His chest is clear," Daniel stated, his eyes locked on the monitor, processing the data faster than a supercomputer. The blast wave didn't just collapse his lung. Look at his abdomen. It's distending rapidly. He's bleeding out internally, spleen or liver. If you open his chest now, you'll drop his core pressure to 0 and he dies on this table. "You don't know that," yelled Thorne, though his voice lacked conviction. He was staring at the rapidly swelling abdomen, realizing Daniel was absolutely right. "He needs a reboa to clamp the aorta and stop the abdominal bleeding, or he needs an immediate XLAP surgery," Daniel commanded, shifting his gaze to Thorne. "Dr. Thorne, if you are the elite surgeon you claim to be, go scrub in. But right now, I need to keep him alive for the next 3 minutes so you have a patient to cut." Thorne was paralyzed. He was a brilliant surgeon in a controlled operating room, but in the raw, brutal chaos of battlefield trauma, he was out of his depth. Daniel didn't wait for Thorne to recover. The patient's airway was failing. "He's lost his gag reflex. I need to intubate. Hand me a Mac 4 blade and a size 8 tube," Daniel ordered the intern. As Daniel leaned heavily over the surgical table, tilting the massive operator's head back to insert the laryngoscope, his loose blue scrub top snagged at the edge of the Mayo stand and tore open at the collar. The harsh fluorescent lights of the trauma bay illuminated the right side of Daniel's chest. The yelling instantly stopped. Thorne gasped. Miller, the lead operator, took a stunned step forward, his eyes locked on the black ink and jagged scars now visible on the quiet nurse's skin. The harsh fluorescent lights of the trauma bay illuminated the heavily muscled right side of Daniel's chest. The loose blue fabric of his scrub top hung open, exposing a canvas of violence and history that instantly silenced the room. Burned into the skin over his pectoral muscle, partially obscured by pale, jagged blast scars that looked like they had been hastily stitched together in the dark, was a pitch-black tattoo. It was an unmistakable, undeniable symbol, a Navy SEAL trident. But it wasn't just a standard Budweiser. Wrapped around the golden eagle and anchor was a grim, cowled skull gripping a scythe, the legendary, deeply classified insignia of Naval Special Warfare Development Group, SEAL Team 6. Beneath it, inked in fading Gothic script, were the words, "Wraith Actual." Miller, the giant tactical operator who had just threatened to break a security guard's arm, felt the air leave his lungs. His hand slowly dropped from his holstered weapon. The color drained from his soot-stained face as he stared at the ink. He knew the ghost stories whispered in the barracks. Everyone in the special operations community knew the legend of Wraith Actual, the phantom medic who had dragged 14 men out of a burning compound in Fallujah with 2 bullets in his own back. The man was supposed to be a myth. "My God," Miller breathed, taking a reverent step backward. Dr. Thorne, entirely oblivious to the military significance of the tattoo, but visibly shaken by the terrifying web of war-torn flesh on Daniel's chest, stammered, "What are you doing? You can't intubate him. You're not certified." "Tube is in," Daniel interrupted, his voice a cold, mechanical hum of pure focus. He didn't even look down at his exposed chest. He flawlessly secured the endotracheal tube and attached the bag valve mask. "Sarah, squeeze the bag. 1 breath every 6 seconds. Intern, give me a Reboa kit, now." "A Reboa?" Thorne choked out, his eyes wide. "That's a complex endovascular balloon occlusion. You have to thread a catheter into the aorta to clamp the internal bleeding. You need fluoroscopy. You need a vascular surgeon. You will rupture his femoral artery." "I don't have time for a fluoroscopy, and I don't have a vascular surgeon. I have you, and you're currently in shock," Daniel said, his voice completely devoid of insult, merely stating a tactical fact. "I've done this blind in the back of a C-130 under mortar fire. I can do it in a brilliantly lit trauma bay." The intern, completely terrified of the surgical chief, but entirely mesmerized by Daniel's absolute command, slapped the Reboa kit into Daniel's waiting, blood-slicked hand. Daniel moved with terrifying, fluid precision. He didn't rely on expensive imaging screens. He relied on the tactile feedback of 20 years of catastrophic combat medicine. He fed the guide wire into the femoral artery he had previously secured, his fingers moving with millimeter perfection. He advanced the balloon catheter up into the patient's descending aorta. "Zone 1, Daniel muttered to himself, his eyes closing for a fraction of a second as he felt the subtle resistance of the arterial walls. Balloon in position, inflating now. He pushed the saline into the syringe, inflating the tiny balloon inside the dying man's primary artery, effectively clamping off the massive internal bleeding in his abdomen. Instantly, the frantic, terrifying alarms on the cardiac monitor ceased. The plummeting blood pressure, which had been seconds away from a flatline, sharply spiked and stabilized. 70/40, then 90/60, then 110/70. A collective gasp echoed through the trauma bay. The impossible had just happened. The rookie clinic nurse had just performed a masterclass blind endovascular procedure and brought a dead man back to life. Daniel locked the catheter in place and finally looked up, his icy, unblinking gaze locking directly onto the pale, sweating face of Dr. Thorne. "The internal bleeding is temporarily halted. You have roughly 45 minutes of occlusion time before his lower extremities suffer ischemic damage," Daniel stated, his tone flat and authoritative. "He is stabilized and ready for transport. Do your job, doctor. Take him to the OR and sew up his liver." Thorne nodded numbly, completely stripped of his arrogance, his mind unable to process the elite medical miracle he had just witnessed. He motioned weakly for the surgical team to unlock the stretcher. As they began to wheel the stabilized commander toward the surgical elevators, the heavy, reinforced doors of the emergency room didn't just open, they were violently thrown wide open. The piercing screech of police sirens and the deafening roar of a second wave of military helicopters outside reached a fever pitch. A squad of heavily armed military police swarmed the hallway, instantly forming a perimeter. Behind them, marching with terrifying, synchronized purpose, were 3 men whose presence made even the seasoned tactical operators in the room snap to rigid attention. 2 were 2-star admirals in full dress uniform. But it was the man in the center, a towering, silver-haired man wearing the distinct, heavily medaled uniform of the chairman of the Joint Chiefs of Staff, who was commanding the room. And he was looking directly at Daniel.
The heavy silence in Trauma Bay 1 was deafening, broken only by the steady, rhythmic beeping of the stabilized patient's cardiac monitor. The squad of military police secured the perimeter with cold, terrifying efficiency, their M4 rifles held at the low ready. Dr. Aris Thorne, his expensive scrubs stained and his perfect hair finally ruined, puffed out his chest. Desperate to salvage his shattered kingdom and his bruised ego, he stepped directly into the path of the towering chairman of the Joint Chiefs of Staff. "General, Admirals," Thorne stammered, his voice dripping with its usual arrogant authority. "I am Dr. Aris Thorne, Chief of Trauma, we have stabilized your asset. However, I must demand the immediate arrest of this man." Thorne pointed a trembling, accusatory finger at Daniel. "He is an insubordinate orderly who assaulted me and performed a highly illegal, unauthorized surgical procedure on your commander." The chairman, a man with eyes like chipped flint and a chest full of ribbons that spoke of decades of classified warfare, didn't even blink at the surgeon. He didn't break stride. He treated Dr. Aris Thorne as if he were a piece of misplaced medical equipment, smoothly stepping around the sputtering chief of trauma without uttering a single word. The room held its collective breath as the highest-ranking military officer in the United States Armed Forces stopped directly in front of the broad-shouldered, blood-soaked 45-year-old clinic nurse. Daniel stood at attention. His torn blue scrub top still hung open, revealing the grim, cowled skull of SEAL Team 6 over his heart. The chairman snapped his heels together. The sound echoed like a gunshot in the sterile bay. He raised his right hand in a flawlessly crisp, deeply respectful salute. Behind him, the two-star admirals immediately followed suit. The heavily armed tactical operators in the room, including the giant named Miller, stood at rigid attention, saluting the quiet nurse. "Master Chief Vance," the chairman said, his voice carrying the heavy, gravelly weight of immense authority. "Or should I say, Wraith Actual? It is an absolute honor to finally meet you in person, son." Dr. Thorne's jaw practically detached from his skull. The medical students and nurses stared in wide-eyed, absolute shock. Nurse Sarah covered her mouth with both hands, tears welling in her eyes. The slow, bumbling rookie they had spent months mocking wasn't just a veteran, he was a Tier 1 legend, a living ghost of naval special warfare. Daniel slowly returned to the salute, his face a mask of calm, weary professionalism. "Just Daniel now, sir. I'm retired." "The man you just pulled back from the abyss on that table is Commander Hayes. He is leading the most critical counterterrorism task force in the hemisphere, and from what my men just reported over the comms, he would be in a body bag right now if you hadn't been standing in this room." "Master Chief?" Thorne choked out, his voice squeaking like a frightened child as his brain completely short-circuited. "He's just a nurse." The chairman finally turned his terrifying gaze onto the chief surgeon. The temperature in the room seemed to drop 10 degrees. "Is it Dr. Thorne?" the chairman growled, his voice deadly quiet. "Master Chief Daniel Vance is a decorated lead medic of the Naval Special Warfare Development Group. He has performed more complex trauma surgeries in unlit, hostile environments while taking active enemy fire than you have performed in your pristine, climate-controlled operating rooms. If Master Chief Vance decided to perform open-heart surgery in your cafeteria with a plastic spoon, you would stand back, shut your mouth, and take notes. Do we understand each other?" Thorne visibly shrank, the last remnants of his massive ego completely and utterly vaporizing. He looked at the floor, his face burning with a humiliation so profound he couldn't even speak. He managed a weak, pathetic nod. "Yes, sir." The chairman turned back to Daniel, his stern face softening just a fraction. "We could use a man like you back at command, Master Chief. The instructor billet is always open. You don't have to put up with this." "With respect, sir," Daniel replied quietly, looking around the chaotic, blood-stained trauma bay. He met Nurse Sarah's gaze and offered her a tiny, reassuring nod. "I think I'm exactly where I need to be. Someone has to keep the doctors in line." The chairman smiled, a rare, genuine expression of deep respect. "Carry on, Wraith." As the military brass escorted their VIP to surgery, leaving the civilian doctors in a stunned, humiliated silence that would last for weeks, Daniel Vance simply turned around, grabbed a mop from the corner of the trauma bay, and quietly went back to work.